Disruptive innovations in technology can be seen in every sector. From auto to banking, all industries are experiencing a transformation, and the healthcare space is no different. Digital advancements in the medical field have led to the rise of technology enabled care. Hello, I'm your host Shiladitya, and I would like to welcome you to Capgemini's Techipedia series season 2. Get ready for some interesting conversations and some even more interesting guests. On that note, in today's episode of the Capgemini Techpedia series, I will be in conversation with Atul Kurani, the VP Global Health Medical Practice and IoT at Capgemini Engineering, and Ayan Choudhury, VP Imaging System Software India at GE Healthcare. In today's discussion, we'll be talking about the digital healthcare space, telehealth, and so much more. Let's take a quick break as we get ready for this insightful conversation.
Hey everyone, it's been another great week on the IVM Podcast Network. On Cock and Bull, Cyrus, Meghnad and Akash discussed the leaked video of Virat Kohli's hotel room in Australia and the boycott Cadbury fiasco. On all things policy, the Takshashila folks talk about collecting accurate information in the most effective way and its implication for public policy. On The Habit Coach, Ashton tells us how to overcome self-doubt and believe in yourself. On This Round is on Me, Gauri is joined by Kirti Punia, co-founder of the apparel brand Relove. Kirti shares her views on greenwashing and the industry's move towards sustainable products. And on The Longest Constitution, Priya breaks down the appointment process of Supreme Court judges. Once again, don't forget to visit our merch store on ivmpodcast.com. We have some super cool and exciting stuff for you. Also, do follow us on social media properties. We are at IVM Podcast on Twitter, Facebook, Instagram, and LinkedIn. Also, do remember to spread the word, as you know, it helps a lot. And of course, don't forget to rate and review our shows on whatever platform you're listening to them. You can also check out all our shows on youtube.com/IVM Podcasts. And finally, we would like to thank our sponsors this week: Bumble, Heads Up for Tails, Kotak Privy League Program, and HDFC Mutual Fund. Thank you so much for making this possible.
Hello, everyone. Hello, Atul. Hi, Ayan. How are you doing? Thank you so much for being on this show today. Welcome. Welcome to Capgemini's Techipedia.
Thank you, Shell, and happy to be here. Looking for a very, very fruitful and engaging discussions.
Thank you so much.
Thank you, Shiladitya. Good to be here and good to be part of this discussion with Atul. Looking forward.
No, thank you both for being here. You're the experts here today, and we have a very interesting topic also, which is how new age tech is sort of revolutionizing healthcare. And given the amount of experience in the room between the two of you across sectors, across various roles and innovations that you've been a part of over all these years, I think the first thing I would love to direct to either of you, the question is, can you give us a little bit of view on how these past few years technology has really changed, I would say, the healthcare space overall? I think, Atul, if I can ask you to sort of take that up first.
Definitely. I'd like to go first with your permission, Ayan.
Please.
I feel like, in a way, like pandemic gave us the biggest opportunity to revolutionize healthcare using the technology. Everything seems to be accelerated in terms of technology post-COVID. And if you were to just look into numbers, and I'm not a very much a number person, but overall, I will feel that the telemedicine piece possibly would have accelerated double than what it was pre-COVID times. I think like a lot of data is getting collected by various, I can say, agencies. Overall, the regulation piece has accelerated a lot. If you can get a vaccine out, possibly within a year, you can see like what revolutionary, I can say, medicines and vaccines will come in time to come. It will be very quick. It will be, I can say, tested with, I can say, enough of precaution, but the benefits will be much quicker compared to possibly the huge, I can say, drug cycle, what it used to take. Overall, I feel from a technology side, anything which is going to do cheaper, better, faster is going to be the thing which will sustain and last. From I can say cheaper part, I may come a little later, but if you look for better and faster, this is exactly what has happened in last I can say 2 years. Just from I can say better part of it, just see like a amount of I can say things which has happened with respect to telemedicine. The biggest challenge in our healthcare industry is I can say availability of medical staff and paramedical staff. And this particular things got addressed using a lot of telemedicine, and how it has changed. You can get a best possible advice from the best doctors across the globe, and possibly have a second opinion. The power of I can say data has gone to such a level where patients are much aware. They have a lot and lot of things on your finger, with mobile, giving them a lot of I can say early indications. But then it gets validated with a lot of I can say AI based sites, which could be like in India it could be secondopinion.com, or if you take it down from I can say startup like yours.md, which is nothing but live healthily. It can tell you like whether the symptoms what you are having with a comorbidity, how it is going to look like. So patient is getting a lot of empowerment. They can get a second opinion. And in terms of pure like faster piece of it, some of the advent of technologies like 5Gs and other things, I think are going to totally change the way the treatments are going to be. One of the most I can say thing is that can you take the healthcare to the most remotest area at a right price point? That has been a challenge across the globe. I think like with this particular I can say technology changes and revolution, you would able to take I can say to the last person in the village. They can get a benefit of I can say healthcare with a technology. Some of the examples are that with so much of issues where people from village they delay their treatment or going to the metros where the doctors and equipments are available. At least with the I can say telemedicine part of it, they can get something immediately. With AI and other things, they can get at least an advisory that they need to come and see the doctor. If they can at least do that, I think like you can save a lot of lives. So according to me, like technology has been a boon in last 2 years.
No, of course, definitely. And Ayan, if you would like to add to that, please.
Certainly, I think Atul, you covered the key points very well. And if I can give a view from the being part of a product organization and how we have looked at the products and the usage of those in the last 2 years or so, we all know medical and healthcare industry is so relevant. It touches all of our lives in some way or the other every day. But the last 2 years we have seen how the need of access has been so critical. Access of healthcare, right? Even today, half of the world does not have access to quality healthcare. Very
Right.
important and relevant for India, right? So how do we help healthcare being able to be accessed to a larger population? That's where digital is actually going to play a lot larger role. What we have seen in many other industries, healthcare is actually going to see that same digital revolution that we have seen in India. Whether we talk about virtual care, we talk about telemedicine, telehealth, this is going to really help healthcare to be accessible to wider parts or inner parts of rural India, for example, right? So that is one very key thing. The other thing that we have seen is how quickly and how efficiently how we can improve the productivity of these medical devices. Because if you recollect during the COVID, we were doing X-ray scans initially, then doing CT scans to figure out the impact and severity of the issues. So with so much surge, what we were doing maybe in a normal diagnostic center or hospital, 30, 40, 50 scans, the numbers may be 2x, 3x at some point of time. So how are we able to scale? And that is not going to change because the awareness of healthcare is very high now. That everybody is looking for quality healthcare. How can we prevent rather than trying to basically, look at when the problem happens? So how are we able to optimize workflows? How are we able to have much better productivity? And digital, is going to play a big role. Related to that is, in this time, you have a requirement of high skilled staff who is going to be able to run this. So how are we going to address the surge in the skill requirement or the healthcare domain? There again, in terms of learning, in terms of remote access to all of the skilled labor, that's going to be a very big benefit. And definitely, digital is going to play a big role. And, last but not the least, if I look from the diagnostic point of view, from the innovation point of view, a large part of today, the challenges in terms of clinical errors. We are scanning, for example, if you're doing, CT scans, X-ray scans, MRI scans, the radiologist or the technicians is doing so many scans, and minute details may get lost, and those can be very critical in terms of detection and prevention of diseases. There again, technologies like artificial intelligence and deep learning, which can help radiologists, the clinicians to pinpoint and detect, our aid in detection in many cases is significantly going to help improve. So in a nutshell, digital is definitely going to help. Of course, there are other things in terms of digitizations of health records, all of those sort of things. So absolutely, very, very exciting time for healthcare in terms of digital going forward.
And I may add little here, and possibly this is my personal view. I don't know, time will say that whether it will be true or not. I think this is the first time in a history of technology, specifically from India's point of view, that from a fast followers, India can be the leader and innovators in a digital space. And see, if you look into a traditional digital journey, it is a data journey, data to information, to knowledge, to wisdom. Until you reach the wisdom, you don't make money, which is basically you keep on investing, assuming that a wisdom will happen at certain point in time and you will start making money. And if you are looking for actually a large data sets and looking for a large digital talent, I think everybody knows from a data points that 80% of the talent lies between India and China. And overall, people have already made their decision that which way they want to go between India and China. And we are in a very, very, I can say, enviable space in this case, that India can take a leadership in digital, where at a right price point with a large data sets, you will able to experiment all the data models, and then you can actually monetize it across the globe. So in healthcare and in digital, I feel that with the product companies like GE and where Ayan comes from, and a good services industries where India is thriving on, we could be world leaders. So that's one part. And the second thing I possibly want to really talk about, the last piece, which I said cheaper, better, but I didn't talk, better and faster, but I didn't talk about cheaper part of it. See, the cheaper journey is going to happen over a period of time once the thing starts monetizing. And that's what always has been, that you have to see the technology. Right now, I don't think so the digital technologies are coming at a price point which is affordable. In case of India, it is still cheaper because according to, I can say, basic thumb rule, 90% of Indians have a mobile. And in general, if you can look from that part, and if you can get a free app which can do at least basic part of it, it has come to a price point which is affordable to everybody. But for I can say larger population, to get a price point down, I think as the data starts monetizing, as we start more learning model, I think this will drastically come, and the fruits will come of cheaper part, possibly at least a couple of years down the line, but it will happen. So it is like any technology curve. Initially, it is little, I can say, expensive. Tech companies are making money right now. Overall, in a period of time, it will monetize, and it will come at a right price point.
I mean, I could not agree more with you, Atul. I think you mentioned this, so well, that I personally feel, healthcare is at that inflection point, like what we have seen in telecom and financial in India, where we have taken the leap because we were behind, but digital has, enabled us to take the leap. Healthcare is at that point that digital can really help us in India really be able to bridge that gap and leap forward. So I feel that's exactly the opportunity that is in front of us. And it is us that how we can make that accessible, the healthcare accessible to broader world. In fact, if you look at from government initiative point of view, there is a lot of focus. There is National Digital Health Mission by Indian government, right, which is really focusing on this part. So absolutely, this is our opportunity to seize.
Right, exactly.
No, absolutely, Atul and Ayan, thank you so much for that the detail there. I think everything you spoke about, right? All of the factors, not just in the last 2 years, like the overall digital revolution which has been happening in India has definitely aided healthcare. And healthcare, obviously, in the last few years has become the most, I would say, focus area for a lot of our citizens. So I think all of this combined is a net better for our country, for the people, and for the industry overall. One of the things which you both touched upon, and I'd like to go a little deeper into, is actually that the part of telemedicine, or the part of technology-enabled care, as you would call it, and how that's getting delivered. Right, there are so many nuances to what when you bring technology in the actual delivery of healthcare. Right, you mentioned mobile apps, you mentioned AI in your software which runs these medical imaging products. There's so many more layers to when you rely on technology to actually do a part of the healthcare for the doctor, or or on behalf of the patient, or that piece is something I would love to get into. So can you tell us about why you think technology enabled care is actually a big game changer for this industry? So
Sure. Maybe I can take that first and request Atul to add on. So if you look at healthcare, if we keep patient in the center and look at healthcare delivery, there are three parts to it, right? First is about prevention and wellness, right? How do we basically make sure all of us prevent, right? At the end of the day. So you talked about wearables, you talked about our mobile devices, or many other ways that we are more conscious about simple things like our heartbeat, our
correct.
many things, how much steps we are taking today. So simple things awareness create in terms of our wellness, our ability to prevent many of those sort of things. I think it starts from there. From there, actually it's about the diagnostics, right? When you have a problem, how are we being able to diagnose a problem? For example, India is really having large number of cases in terms of oncology, cardiology, and many other things. So how are we able to provide the latest technologies to detect this early? Today a large portion of deaths that happen in India in cases of cancer is about detection, right? And how are you able to detect, cancer, oncology, situations early? And that's where, technology, digital technology is really going to play a big role. Spoke about the AI algorithms, spoke about those. How are we able to detect some of this, early enough? And of course, then the third one is about the care delivery. Care delivery need not only be at the hospital, it also can be care delivery remotely. Today you can have care delivery even at home. We have seen this, we spoke about earlier about COVID, how care delivery can be even done remotely. And that is going to be very important in terms of that. And that's where things like being able to get the best of the medical support, best of the support remotely. Today you will be able to, I mean, how many of us post COVID are actually going and consulting a doctor, unless it is a very critical need? Many of us actually have moved to tele consultancy mode, right? That has become part of a normal thing. That is going to be post operative care, many of the things post hospitalizations at home. How do you provide the best of the facilities? Those are going to be very, very key. So if you look from the patient centric point of view, right from prevention all the way to diagnostics, to in terms of post care delivery, all of this is going to be the center of digital way of delivering in the medical healthcare domain.
Just to add, you have captured everything. I'm not going to say anything more, but possibly throw some of the examples, the type of work which we are doing in India, and that can tell you like a little bit about where it is going. Take a very simple case of skin cancer, and possibly like 1/5 of the cancer patients have a skin cancer, and to detect it, I think normally doesn't people don't see something on the skin or patch and go and see the doctor. They feel that it will take care of itself and it will heal itself and so on. But with a small mobile app, and if you just scan your body parts, you are able to go for, I can say, actually like detecting whether it is a skin cancer, and it is as precise as a doctor would have done it. And in general, like how does a doctor do it? And let us get into a little bit of into the brain of a doctor. It is all about the data, and it is all about the images. images, all your visual memories, and that's where like all your scans and everything. That's what radiologists actually do with his studies, and then it is all about the data which is there. So I think like a lot and lot of things with the connected devices is coming up, and with a connected device, which could be purely as a wearables, or it could be connected medical devices, or it could be mobile apps. All of them are giving this two part, data and images, to the doctor. And in general, if you can do a lot of things using algorithm and do an advisory, I'm not saying do a diagnostic with that, at least an advisory, and then from that advisory possibly like follow up with the doctor, you can actually like do a lot of good for the mankind. So I feel that this particular small piece of data and images is going to change everything with a, I can say, that entire connected ecosystem. I'll give you an example that we work here with a robotic surgery for one of our customers from North Americas, where I can say a semi-skilled doctor or possibly a fresh doctor from the education institute can do a very precise knee replacement surgery, which typically may take almost like I can say years of experience before a knee surgeon can actually go and do so.
Wow.
And that's where like what happens in this particular type of robotic surgery, it's not that robot is going to do a surgery. All the, I can say, surgical tools, which are right from, I can say, scalping, cleaning, I can say, cutting, stitching, all these things are the tools which are actually having all the controls. You take that tool in your hand, this tools are actually like controlled using cloud technology, and it will do a precision surgery based on a live image of a surgery, or using a Kinect like system. You would have played the game Kinect, which possibly has a Microsoft cameras which are pointing to the actually area of I can say surgery, and you would do a guided surgery. Now the tools are so precise that it will take it to the right area. It will apply the right pressure. If you try to go and cut at a place which is possibly going to be more than required, it actually retracts. Okay, and that's what it does. Now this is done in two ways. One is that it is learning on a fly with your earlier taken CT images and the live images which is happening there. And second thing, you can have an expert doctor sitting possibly in London in his evening time guiding you there. Okay, both the things are happening virtually on a real-time basis. Now this is a pure power of a technology. This is all connected device, this is connected OR. This is where it is going. Now I strongly feel that over a period of time, the thing which Ayan mentioned earlier, that healthcare will become very much proactive rather than reactive, what we are having right now, what we call as a sick care, that you are sick and then you are going. In general, if you are having sensorizations, if you have all these devices on your body like Fitbits and everything, and I will talk a little bit more later on, but even I predict that there may be implantables, I can say, in your bodies, and I foresee that in possibly a decade from now, there may be at least few of the sensors everybody will have on the body. And in that case, most possibly the doctor is going to say that you need this, please come, rather than you taking an, I can say, appointment to go to a doctor. That's what is where healthcare is going to go. And it is all for betterment of, I can say, mankind. So I see a great opportunity with the technology.
No, absolutely. And if I may add, a couple of more points, to all the right things you said, in terms of data, right? So much of data you mentioned about, getting data into the cloud, right from the wearables to machine communication, to so much of data, patient data, image data, all of this data. So data is significant amount of data needs to be accumulated, and then each of these data needs to be correlated, it needs to be triangulated, and then we come up with what we give the insights. That's the value that digital and innovation can provide, in terms of then telling whether it's the clinician, whether it is a radiologist, or whether it is a patient, that this is what you need to do. I think that is what the power of it today. Absolutely. And I think you talked about the live things. That is so real. And we are also looking or rather in the midst of 5G rollout in India. I mean, this amazes me to see how this will all change in the coming days, in the next few months and years, about how this will be accessible not only from London and Paris, but also in our remote villages, right? Yes. So that's the power.
No, I definitely feel that one of the biggest revolution from that technology side is 5G and imaging. And I feel like, Ayan, you are going to do some fantastic works in coming times, because you being the possibly like the best in imaging side of it, and 5G is something which possibly is going to be that game changer, something which is happening on a real-time basis, something which is possibly like going to do a lot of AI over the speed what is required. You may at least get a very, very quick advisory, and you don't have to go through the painful process which a radiologist does it down to study one CT study or something which may take 2 hours or something. You can localize it possibly in 5 or 10 minutes. So this is going to solve both the problems of speed, which is so critical in healthcare side, and then a shortage of the manpower.
Just to add, since you mentioned about 5G and G healthcare, we just inaugurated, a month back or maybe a month or two back, the first G or 5G full lab in G healthcare in India.
Wow.
So that is something, we are significantly investing on, and we hope that that is going to really change the way we are going to provide healthcare services to our customers.
No, wonderful. I mean, all of this innovation is essentially just it's compounded, right, by obviously the various products that you build on top of it. Now that you have, let's say, 5G, you know the connectivity will be fast enough to do much more real-time video, much more high-quality video, detailed operations like the one, Atul, you just mentioned. It's unimaginable maybe a couple of years ago when this infrastructure did not exist.
Right.
Right. And to touch upon the point about, the changing roles of both the players in the healthcare life cycle, right, which is both the patient as well as the doctor. Now, both of these players are assisted with technology on both of their ends, and of course, connectivity in between. I just have one point, maybe a counterpoint to, how if there are any perils to this. But do you think that this essentially, so much tech enablement, so much assistance is actually changing, let's say, the role of the healthcare provider, as well as giving too much data to, let's say, the patient beforehand? So, what are the counterpoints to, all of this happening so fast? If you could mention that.
Like at least like I think like everybody says these things in India, right? Half knowledge is possibly going to be very, very dangerous, right? And that's wherever whenever something happens to you, you start Googling and possibly get into that paranoia of saying that you may have that possibly like a dreaded disease or something which may not be true, and you require an expert to.
The joke is everything points to cancer.
right. So that could be something which can create a lot of, I can say, anxiety amongst the patient before they go and see them. Second thing is like what I hear, and this is something which is good and bad, is that I hear these things, and it is still not in India, but across the globe, where insurance is the, I can say, very much into play whenever you are into healthcare. Insurance providers, if they dictate the terms based on the data, it could be very, very, I can say, bad thing. There are good things of it, where if you say that, okay, I have, let us say, symptoms of cancer, and you are a smoker, and maybe like a cancer, the insurance company is forcing you to say that, okay, you should possibly reduce your smoking or stop your smoking, and then we will bring down your, possibly, let us say, your insurance rate. That is good. However, assume that it takes to the other extreme, that where data is there, and there could be little bit of either concerns with the quality of a data, or even if the data is right, and if insurance company says that I will not give you the insurance because you are a smoker and you have a cancer, that could be a totally like misuse of this data. So it has to be used very judiciously. These are like some of the, I can say, pitfall of it. But overall, I think like the data, if it is used judiciously with a right amount of I can say maturity on the data, you should still, I can say, like get a much more benefit from the data, rather than looking for I can say, some of the downside of this data. But I think like more and more important part, what you said about the role changes for the, I can say, both provider and the patient is going to be very, very important, and you are going to see a totally different type of science sense of that changes, because it is, as I said, it is becoming more proactive than reactive part of it, right? So if you are proactive part of it, then what is going to happen is that not only your caregiver is going to be very good into medicine part of it, but he will be virtually your coach, your mentor, who is going to actually dictate your lifestyle. So that's a, I can say, different type of I can say, medicine professionals you are going to see, who are a little bit of a people who will actually change your lifestyle, and that's what I see, a change of role, and it will happen gradually, but that's the skills which will happen. And from a patient side, I think like there is going to be lot of changes, where since everything is available on the fingertips, and a lot of data consolidation may happen on a cloud with Ayushman Bharat. All the records may be digitized on the thing. It will overall reduce lot of I can say concerns of data inconsistencies over a period of time. It will not happen immediately. Let us say we are talking about it a decade from now, and everything is standardized and you have it. Possibly like you should not hear that type of things, that oh, in that lab you had a different type of results, you have to go this, you monopolize that entire, I can say, that chain of healthcare, I can say, providers who go for some of the malpractices, but mostly like it is just, they just don't rely on the data of other labs and other I can say scans and so on. So that can bring down both a cost, as well as like it will bring down in general a very standardization in the treatment. So
Right.
so overall, like a patient will be more empowered. Patient will feel more confident about what he has done is right, rather than actually doubting all these things. There will be a lot of standardization which will happen across the countries for the quality and actually like the format in which the data will get uploaded. But this is something which is all for good. It will have it happen over a period of time.
No, most definitely.
I mean, if I can add to Atul what you already mentioned, very relevant and pertinent points. In any technology, right, there is always a good side and a not so good side of it, right? You mentioned about a joke, Shiladitya. The other joke is, if you go to a physician, either telemedicine or physically, what we do is take the prescription and start googling about the medicine. That's what we start doing. Earlier we would just uh, just take whatever is prescribed, right? So while there are any technology always has some drawbacks, but I think what technology is doing today is really empowering the patient, empowering people, right? You really have choice. You really have all the data or all the information available to you, right? If you with all the the national health policy that I spoke about, right? The data is going to be accessible across, right? Your data is digitized, so your history, your information of all of what has happened is not going to be in papers and easily accessible, right? So those are things, the benefits are really going to outweigh. Of course, we have to be careful. The policies have to be dealt in a way that we can be dealt with it. The data itself has to be protected, and there is a lot of discussion going on in terms of how we do
Yes.
that. But I think the empowerment to the patients, the empowerment to the physicians or radiologists or anything is a lot more than I think some of these things which we all have to work towards to help improve.
Correct.
Most definitely. And again, we are seeing this happen gradually, but I think with more and more devices coming into the picture, more and more apps, more and more, of course, diagnostics and newer challenges in healthcare also. Last 2 years, I think we saw things which we took for granted suddenly becoming much, I would say, front and center for everyone, right? Whether it's wearing a mask or whether it's hygiene or anything else like that. So I think we will see this constant evolution. And on that note, I actually do want to ask both of you to give us a little bit of forward-looking vision, because this is a lot of what we spoke about is already here. This is already happening, whether it's robotic surgery remotely or whether it's 5G, which is almost almost live with in the market. Could you give us and maybe I'll ask Ayan first, because what can we expect in the future, in the near horizon and longer term? What more sort of innovation in products, in technology do you foresee coming into this sector?
Certainly, Shiladitya, I will start off from the product, point of view. I think, what I started off saying, how can we make our healthcare or medical imaging, for example, much faster, and today, if we go for a scan, if it takes for a MR scan some 2 to 3 minutes, can we reduce those, right? Can we do faster CT scan? But at the same time, when we do fast, it does not mean we compromise on the quality. The quality has to continue to improve, right? So how will we be able to use technology to do things much faster, but much better in terms of diagnosis, right? That is going to be one key thing. The other in terms of automation, right? How do we do automation in terms of patient positioning, right? A lot of times we do scans and we find out that the scan is not proper, there is blurring, there is the quality of the image has not come out well. So how are we going to do things in terms of patient positioning, automation in terms of the workflows, efficiency improvement, and thereby decreasing errors, right? So we already have few of the focus areas in terms of zero click exam workflow, where we will just be able to get all the information and provide the imaging scans much faster. And many cases in terms of making the devices easily accessible. For example, today you have mobile X-ray machines which are close to the patient. You don't need the patient to go closer to that. You have ultrasound which is wireless today, right? In terms of the handle ultrasound device which can do whole body scanning. So there are a lot of innovations which are going to happen in those specific areas. Another big area in terms of remote connectivity, I think we spoke about this. It is going to be virtual care. It is going to be how we provide access to healthcare to the inner parts. There are ways that we should be able to train, because as we scale up, the medical space and healthcare space, we'll also need a very high skilled labor. So how will we be able to have skilled labor across the length and breadth of the country? And for training, you will have to have different ways of having the training imparted from the way it has been done traditionally. So again, a lot of innovation on those ways of it. And then, of course, in terms of while we are doing this standardization, how we have the compliance maintained, regulations, all of those sort of things will have new way of looking at it. And digital is going to have new way of looking at those sort of things. So very, very exciting times ahead. All the latest technologies in terms of the AI, deep learning. I know cloud is going to have a very key way of delivering, because you will have to deal with a whole lot of data, large amount of data, right? And be able to correlate this data and provide the information. So the next few years are going to be very exciting, along with the technologies like 5G and others that we spoke about.
No, thank you, thank you, Ayan. Yes, sir.
See, I was listening and very carefully, and what he said is absolutely like a thing which I foresee as a future. Sensorization and miniaturization, these are the two things which are definitely going to happen on a hardware side of it. I said in an earlier part that I predict that at least few sensors, at least you would have it on your body, which will proactively give a lot of data. And miniaturization, like I can take that recently we have created a portable MRI, which could be put into the, I can say, ambulances. And it is like virtually getting before the operation theater, you already require all the data is already there in your operation, in your ambulance. And this is that initial part which saves the life, right? If you make a delays there, that's where you see the most of the times, like that's where the fatal, I can say, consequences are there. So miniaturizations of considering that MRI machine itself is happening to that level where you will able to do it while you are on a drive from ambulance to the hospital, that is going to change a lot. With data, you are going to do a lot of proactive things. With the genomics, you will know exactly what is your, I can say, history, and you can have a lot of personalized medicine and so on. And that in general, overall, what will it do? It will actually like improve overall quality of care and life expectancy. So the direct implication could be that life expectancies, you expect that it may go up. And I foresee that in that case, most of the times people will not die because of that physical illness, but there will be a major issues on mental illness, because with so much of data flowing around, there will be too much of a mental stress. And that's where like you will see like a lot of things, how to interpret that data is there. Giving a power to patient is very important, but giving that I can say mental stability and how to interpret, leave it to the expert, is going to be very important. Otherwise you will have too much of anxieties from all the markers, biomarkers coming out of it. That is it. Another thing which I see as a huge opportunity, at least in India, is that this is a time where I think engineering, that is industry and academia, specifically medical school, needs to come together. The technology is changing the entire industry, miniaturization, medical devices, data is changing. I don't think so. The doctors who are studying all these things possibly have the knowledge of what is happening in applied sciences here, and there needs to be a collaboration. Similarly, a lot of things which I said, how to interpret the data and what possibly is advisory against what is conclusive part of it, that comes only from a domain knowledge from there, and nobody can replace a doctor. Whatever technology you take it up, I don't think so there is going to be time that you can replace a neurosurgeon with something what you are trying to do. Okay, so this is a time where industry and academia needs to come together. I foresee that a lot of things will be driven by, I can say, some collaborations happening by industry bodies. I think like Ayushman Bharat scheme by government will also bring a lot of things together, and government will make sure that industry is joining hands with academia. I foresee that as a good collaboration. Doctors needs to be a little bit like an engineer and vice versa, and that seems to be a future, at least in a healthcare industry.
And I completely agree, Atul, with you. Just one or two quick points to add. Today, if you look at it, our traditional institutes, which are basically doing more on the science and technology, they are starting to adopt medical stream. If you have looked at ISC, the IIT,
right.
They are collaborating and starting the medical. These are the ones which will start blurring, because you need the combination today of both on the clinical side as well as on the data science, right? And this combination is really going to help create the next level of innovation going forward. So absolutely, completely agree with what you said.
No, absolutely. In fact, good that you mentioned this point. It will, all of this technology will actually change the way people upskill themselves. You both of you work in the healthcare industry as technologists, as supporting the doctors and caregivers and enabling them with technology and devices. But even they have to upskill themselves to be fully tech. Very, very important. I think to end on a light note, I think we will actually be able to understand doctor prescriptions because they will not be handwritten anymore, and they'll be digitized. So, gentlemen, thank you so much for this very, very enriching conversation. I think there are so many points we covered, and we made this a very, very engaged conversation. Thank you so much, Atul, Ayan, for all your time and your insights. I think technology is already revolutionizing healthcare, and thanks to both of you, we now know where this was going to take us further. Thank you so much for being on Capgemini's Techipedia.
Thank you so much. My pleasure.
Thank you. It was my pleasure. Thank you.
So there you have it. Technology has completely changed the face of the healthcare system. It's shifted the power and agency into the hands of patients. They can now access information from the internet, share their experiences, and identify different treatment options well in advance. How do you think technology is impacting the healthcare system? Come and be a part of this conversation on Instagram at Capgemini India, and I'll see you on the next episode of Capgemini's Techipedia series.